Hi there, I'm Shannon Piggott with Breed Specific Healthcare, and this edition of Ask the Expert, we have Dr. Nan Boss with Best Friends Veterinary Center here to answer some questions about how to implement breed-specific wellness in your hospital. You were one of the pioneers in this space and a contributor to the research that was just completed by Genesis Breed Specific Healthcare. The company has added the predispositions for 46 feline breeds, including the healthcare charts and an additional 200 canine breeds. How can you describe the research that you and your team conducted and the results of all of your efforts?
We wanted to create something that would be very usable by a lot of different people because right now genetics testing in animals is very scattershot. So with people, when a baby is born, they prick their heel, they get a drop of blood, they test for over 100 different genetic diseases. We don't have that with dogs and cats yet. We have different labs across the country, each doing 1 or 2 tests. And so it's confusing. There are many more tests coming out. So we have over 125, I think, DNA tests for dogs now. Again, scattered all around. They keep coming up with new ones. It's hard to keep track. Well, our database, we're going to keep track of that for you so that you can go onto that healthcare website and find out what DNA test is available for this breed, where do I send it, how much does it cost, and then you have that information to pass on for the client. You'll also be able to tell, because we've ranked the risks, which ones are the really most important ones you need to talk to clients about. I can't go into an exam room and blitz the client with 25 different topics. I have to pick and choose what's the most important at this age for this particular client that I need to talk about now. I try not to do more than 3 topics that I'm going to educate a client on at one visit, because again, you lose them, they get bored. I try to make it fun and interesting if I can, so I use a lot of models and pictures and things like that. But the database is going to be the master tool that underlines it all, that tells us exactly what is the important thing that we need to be addressing.
Thank you for dialing in to ask this expert. Dr. Boss, thank you for your time and for your insights.